videotape, but the floor is yours. Could you keep the time?
I will.
Tell you,
if you give me a shout. Great. Good morning, everyone. I have a large number of slides. I'm not going to go through them all because these presentations are, as Sean said, will be available online. And I want this really to be a resource for people to use rather than something to go through immediately today. I'm the founder and executive director at the CoHab initiative. CoHab stands for Cooperation on Health and Biodiversity. Our secretariat at the moment is based in Ireland. What I'd like to do over the next 20 minutes or so is give you a little snapshot of, firstly, a little introduction to CoHab, where we come from and what we do. Secondly, I'd like to talk about what we mean by human health and how human health fits into the current paradigm on sustainable development and ecosystem services. I'd like to talk about the linkages between ecosystem services and biodiversity and public health, particularly looking at some of the major public health concerns that biodiversity has a significant impact on. And then to finish, I'd like to just look at some of the ecosystem approaches to public health which are currently being tried and tested, and some of the concepts behind linking ecosystems with public health issues at the policy and at the practical level. CoHab originally came about as a result of the first international conference on health and biodiversity, which took place in Galway in the west of Ireland in 2005. I'm sorry, this has happened to me before. For some reason, my slideshow has a mind of its own, so it might be rushing me through a little bit quicker than I had actually wanted. One of the recommendations from that first conference was that there should be some kind of an international program of work looking at the links between biodiversity and health and helping the health sector to understand what these linkages were, also helping the biodiversity and conservation biology and environmental sectors to understand the distributive impacts, if you like, and the potential negative impacts of biodiversity policies on public health, as well as being able to capitalize on the potential positive impacts that biodiversity conservation could have on health and well-being. Now, I'm speaking largely about biodiversity as opposed to ecosystem services because we recognize that biodiversity underpins largely ecosystem functioning and ecosystem services. And the loss of biodiversity in many cases can threaten the flow, the scope, the breadth, and the accessibility and types of ecosystem services which are accessible to us. So after that conference in 2005, we were approached by the Secretariat of the Convention on Biodiversity and asked, well, could you help put together a framework for what that international initiative would be? And as a result, we ended up, I beg your pardon, sorry. We were then established officially in 2007. We had a second international conference in 2008. And since then, we've been instrumental in helping to get some text into the decisions at the conferences of parties to the Convention on Biodiversity that specifically reference health. We're working towards another conference in 2015, and we're also looking at rolling out regional representation for the CoHab initiative across the world over the next 3 years. So a question which has often been asked to me, actually the first time I was asked it was actually 2 months ago, and for some reason everybody seems to be raising it now, is why health as distinct from well-being? Why do you look at health as being something separate from well-being? One of the reasons is that we recognize that health is actually an important component of what people consider as being part of their own well-being, in kind of assessments of how people rate their own sense of well-being, their own health or the health of their families or the health of their communities, and their access to health care is often considered to be a very significant factor. The other side of it is that public health often affects other aspects of well-being in terms of people's ability to earn a livelihood, to engage with their family or engage with their community. Health is often a significant community concern. You often will see public protests or public discussions motivated by public health issues. It's often also a significant proportion of individual budgets in terms of the amount of money that households will spend in terms of medicine or indirectly in terms of the food that they purchase. It's also obviously a significant proportion of national expenditure. It's over 25% of government budgeting at the moment in Ireland, for example. And it's also an important aspect of government services at the front line at the community in terms of how people interact with their local, regional or national governments. Obviously, as well, when we're talking about mainstreaming biodiversity across different sectors, you have to deal with public health in the same way as you would be dealing with transport or agriculture and so on. Another way to look at it is that health is increasingly being recognized as a core element, if you like, and an indicator of sustainable development. But beyond that, particularly in the development aid circles, we're seeing that public health is considered to be a requisite, if you like, a prerequisite of sustainable development. It's not something that happens when development is sustainable. In order for development to be sustainable, you will need to address public health issues. One of the reasons for that is that public healthcare systems can have in their own way a significant impact on the environment and on ecosystems, either through the use of medicinal resources from nature or pollution from healthcare facilities, the use of energy in hospitals and so on. And also ecosystems themselves can be affected by population status. People in a state of poor health are often forced into taking decisions or engaging in behaviors that can further impact on ecosystems. Perhaps people in poverty have to look for resources from ecosystems that perhaps cannot sustain that level of exploitation. Public health is also connected to a large range of the other issues in this concept of sustainable development, and we've seen in recent years that biodiversity has been recognized as being at the center of a whole range of global crises, including health and climate change, for example. The loss of biodiversity was pointed out by the World Economic Forum in this report from 2010 as being the nexus of a range of global risks. So in order to address a whole range of international crises that themselves are in many ways interlinked, increasingly biodiversity, the loss of biodiversity and the degradation of ecosystems and loss of ecosystem services is being recognized as being a core factor. So what do we mean by health? You know, just to have a quick definition as such, many of us ourselves might feel that we understand what our own health is, but in terms of the policy aspect, the scientific aspect, and actually rolling out healthcare on the ground, the definition is quite important. This is kind of the standard definition from the preamble to the Constitution of the World Health Organization dating back to 1948, which stated that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Now, at the time, that was extremely important because it recognized that health was more than just about the self and about physical and mental health, but also it recognized links with the wider community, access to society and access to services. But the question has been asked recently, well, is that definition still relevant, particularly in an increasingly globalized world, in a world where transport and trade can lead to the movement of disease organisms, the movement of sick people around the world in a matter of hours or days. So one of the concepts which is being floated in the medical literature over the last 10 to 15 years, and particularly in the last 5 years, is the need to expand our definition of health, not just to look at how people are right now, but also looking at our ability to adapt to challenges, to our ability to adapt to public health stresses. For example, if any of us perhaps is suffering from a head cold or a mild bout of flu, or like me, I had a pizza here in town last night and I'm actually feeling a little bit going green for Wales right now. I mean, our health is more than just the state that we are in now. I mean, I would consider myself to be largely quite healthy, even though I'm not particularly feeling the best this morning. What's more important is my ability to adapt to any particular health challenge. Am I going to get over this? Of course I am. Well, I hope so. So we see correlations, therefore, with current concepts of what we mean by ecosystem health. When we speak about ecosystem health, we speak about the ability of ecosystems to adapt to stresses, to be resilient in the face of perturbations, of changes such as climate change or pollution or overexploitation. So this concept of changing the definition of health to include our ability to adapt is very useful in terms of linking ecosystem science with current concepts in public health. Now, a lot of this has been, in terms of the the interest in the linkages between biodiversity and human health, a lot of it has been driven by the environmental sector and particularly by conservation biologists. When we see that the current pushes in terms of ecosystem approaches to public health, a lot of it is being driven, for example, by the Secretariat of the Convention on Biological Diversity, and even CoHab has its own background in biodiversity science. But this hasn't always been the case, and I'm just showing the covers of a couple of early editions of an important journal called Emerging Infectious Diseases, which is published, it's free online, by the United States Centers for Disease Control. This was initially launched in the 1990s, and from the very first issues, they started dealing with outbreaks of infectious disease and emerging infectious diseases that were directly tied to wildlife and directly tied to changes in ecosystems. So the medical and the healthcare communities have understood this type of approach or this type of concept that biodiversity, ecosystems, and public health risks are linked from quite some time ago. And some major scientific announcements and discoveries have helped to kind of coalesce this, if you like, in the science or in the healthcare community. For example, this is a snapshot of an article from Nature back in 1999, which was dealing with the discovery that HIV was initially came from chimpanzee populations in West and Central Africa. We also see then from the Millennium Ecosystem Assessment in 2005 that the linkages between ecosystems and public health were getting increasing attention. And one thing which is important to note is that the World Health Organization themselves were quite heavily involved in preparing the text for certain sections of the Millennium Ecosystem Assessment, and they were behind the synthesis report for public health, which is worth reading and you can actually download for free online. This particular diagram, which I'm sure everybody is quite familiar with, everybody that works in ecosystem service areas, this is from the Millennium Ecosystem Assessment and shows the correlations between different types of ecosystem services and different constituents of well-being. Now this model as such dates back to 2005 and has been adapted and challenged and is being developed quite significantly in the intervening years. And there are, I'm certain, new iterations of this to come out increasingly as we get more information and more knowledge on the links between ecosystems and human well-being. But it has been extremely important as a tool for engaging with policymakers across different sectors, including public health, on the broader links between ecosystems and human well-being. So we've seen as well in the last number of years, particularly since the turn of the millennium, an increasing body of evidence linking biodiversity and ecosystem services to human health and well-being. We have dedicated journals such as this EcoHealth journal. We have dedicated publications, scientific and popular texts looking at biodiversity and its importance to human health. Again, we've had the involvement of the World Health Organization, and we've had headlines. This is from the Guardian website, a snapshot which I took. This is dating back, I think, to 2010. Headlines highlighting the linkages between the disruption of ecosystems and the risk of emerging infectious diseases that can affect humans, wildlife, livestock, and so on. We see increasing interest in the links between climate change impacts on ecosystems and subsequent impacts on human health. We've seen an increasing body of evidence looking at the relationships between ecosystem and environmental degradation and mental health issues. And we're increasingly seeing toolkits and practical guidelines for practitioners in health areas as well as scientists looking at different aspects of how biodiversity links with public health. So what I'd like to do is go through just a number of general slides to show some of the key linkages between biodiversity and public health, or some of the key public health issues that ecosystem services relate to. Often, particularly I think in parts of Western Europe, when you talk about ecosystems and human health, one of the first things that comes to mind is recreating outdoors, people getting out and exercising, walking in nature, such as this picture from the Wye Valley here in the UK. And increasingly we're seeing this body of evidence showing that exercising outdoors does have a significant benefit in terms of not only physical health, but in terms of mental health and mental well-being as well. We also see linkages between ecosystems and psychological well-being, and how people cohere in society in terms of community cohesion and community involvement and community engagement. There's also obviously linkages between ecosystems and spiritual well-being, which must also be recognized as an aspect of health, for at least for certain communities. Another important area, and one which often will come to mind, is the importance of biodiversity and ecosystems as living libraries of medicinal products and medicinal compounds. It's interesting to note that a lot of the current decline in output from pharmaceutical companies in terms of new drug entities has been correlated with a move away from natural product chemistry, with a greater focus on designing molecules using computer technology, or looking at it from a purely genetic medicine point of view. It's interesting to note in the last couple of weeks there was a story about a drug which has been in development for about 15 years at massive cost, that was completely synthesized in the laboratory. Turns out that exact same molecule in the exact same form actually occurs in nature. I can't remember the exact name of the medicine right now, but it was identified in the sap from a particular tree in East Africa, which again highlights how often the work that we put in at the laboratory, more and more we realize that the loss of biodiversity could potentially put future medicines at risk. Obviously, biodiversity is the cornerstone of agriculture, and everything we eat and everything we drink. I'm not sure about the pizza I had last night, but the vast majority of what we eat and drink comes from nature. But we're beyond that, the medical community, and particularly people working in areas of dietary health and diet security and nutrition security, are recognizing that diversity in diets is extremely important in terms of protecting people against diseases of affluence, such as cardiovascular disorders, diabetes, obesity, certain cancers, and endocrine diseases, and so on. I mentioned the issue of emerging infectious diseases already. Increasingly, we're becoming aware that in many cases, not all, but in many cases, disruption of ecosystems can increase the risk of the emergence of infectious diseases into the human community, or into livestock, or into other wildlife populations. We also are looking at how wildlife models can be used in medical research, and not just in terms of vivisection and animals being used in a laboratory, but increasingly the medical community is looking at how studying living systems in terms of living physiological systems can lead to benefits in terms of medical discoveries. The reason I have two polar bears is that bears are an example which is often cited. When you think about bears and other species that hibernate for long periods, in which they fall asleep and actually don't move and don't wake up for perhaps 3, 5, up to 6 months at a time, that level of inactivity and that level of lack of exercise and torpor would cause significant problems for any of us here. Never mind not actually using the bathroom for 6 months, which bears don't do when they hibernate. So by studying these models and trying to understand how their bodies deal with the buildup of toxins over time without excretion, we can potentially learn or gain some insights into methods for addressing certain diseases that affect us, such as liver and kidney function problems, and so on. The role of ecosystems in protecting against disasters and reducing the risks of disasters is becoming something that's of increasing importance as we look at the impact of climate change, particularly in terms of flood risk, storm surges, drought, and so on. Where you wouldn't think immediately there's a linkage to health, the role of ecosystems and biodiversity in supporting people's livelihoods and keeping them free from poverty is increasingly important from a health perspective, because obviously, as I mentioned earlier, people whose livelihoods are insecure and people that are pushed into poverty often are unable to look after their own health or the health of their families, or engage properly with the community. Indigenous and local communities can have very specific relationships with biodiversity and ecosystems, and therefore they can have very specific public health challenges associated with ecosystem disruption. And finally, we look at the issue of climate change, and again, it's been mentioned earlier how the conservation of ecosystems can help with adaptation, including the adaptation of health systems to future challenges with the climate. What I'll finish off with is this simple diagram. There's more information in a poster at the side, which you can look at later on. When it comes to actually dealing with this from a policy and a practical perspective, the most important thing in terms of mainstreaming ecosystem approaches into the health sector is to really try and address a number of the barriers and try and understand why the health sector is not fully engaged at a policy level on these issues. I've shown earlier on how the public health sector is very much on board in terms of the science and the research, but this has not translated at all into effective public health policies that recognize biodiversity and ecosystem services as being a fundamental part of achieving their goals. We've seen the WHO, the World Health Organization, engaged in the Millennium Ecosystem Assessment, but again, this has not translated down to national governments. So what we need to do is look at the hierarchy, if you like, the cascade for public health care. In the same way as we have a cascade that I showed earlier on for ecosystem services, linking with human well-being, it's valuable to look at the determinants of health outcomes, the various stages from policy through to practice at the community level that determine an individual or a community's level of health, and identify, well, where can ecosystem approaches or where does biodiversity have relevance in those particular areas. I can answer any questions on that if anyone has any later on. And finally, I just want to say a quick thank you. Sorry, there was a final slide there. Quick thank you to Sean Russell and colleagues at Bangor and the other people involved in putting this together. Thank you very much. Sorry for...
Say that for a moment.